that's where you are, it's where I belong. I do know where you go, it's just where I wanna be. Where are you going? Where do you go? Where do you go? Where are you going? Where do you go? I'm a Superman. I have no answers for you. I'm no hero, that's for sure. But I do know one thing, that's where you are, it's where I belong. I do know where you go, it's where I wanna be. Where are you going? Where do you go? Where are you going? Let's go.
All right, welcome back. Hello. Let me bring you out. Okay, this is going to be the second part. Wow, that was really far focused of central nervous system that we're going to be finishing up today. So you should watch the first part, obviously, before you watch this part. And the first part will begin with the anatomical structures of the brain, the different lobes, frontal, parietal, occipital, temporal, insulas between parietal and temporal. If we cut open the brain, you should know the layers of gray matter on the outside, then white matter, then gray matter deep inside, which is those automatic functions. The basic functions of the brainstem, the three different parts of the brainstem, midbrain, pons, medulla oblongata, which will then connect down to the spinal cord. You should know different parts of those specific gray matter areas, all the different Brodmann's areas of the cerebral cortex that I pointed out to you. And then we'll go over thalamus, hypothalamus, and epithalamus, which is the pineal gland. Actually, we went over those already. All right, so just a quick little review. Now we're going to move on. I'm going to move you in and start to talk about that connection between both sides. We're starting in the notes in central nervous system at the man with two brains. It's just about halfway through the notes. How many brains do you actually have? One or two? Okay, you only have one brain, but they're connected right in the center by the corpus callosum. Now, the corpus callosum has nerve fibers, specifically axons, which are myelinated, so they look white. And the whole purpose of that corpus callosum is to allow both sides of the brain to talk to each other. Keep information going to both sides so we can work as an entire organism. There's a picture of it. See that whitish, or well, it's blue, but the darkish, lightish C shape right in the center, that's a corpus callosum. Criss Cross, the right side of the body is controlled by the left brain. The left side of the body is controlled by the right brain. And at the medulla oblongata, they actually have a crisscrossing of the fibers. That's where they crisscross, okay? And that manifests itself, especially when we see people who have strokes. If a person has a stroke in the left side of the brain, it'll affect the right body and vice versa. But in addition to that, there are specific functions which are unilateral or one-sided. We've talked about speech being one-sided, but supposedly the left brain is more, I should say stronger in math, logic, and language, and the right brain is more creative. It's better with its spatial ability, facial recognition, music, visual imagery, okay? But because of that corpus callosum, it keeps the information going from side to side. So that is true, but there are people who are definitely artistic who are right-handed or right dominant and left brain dominant, okay? White matter versus gray matter. Now, we've talked about this white matter versus gray matter quite a bit. White matter is going to be myelinated axons, and it looks white because myelin is fatty. We're going to see in the corpus callosum, we're also going to see it in a structure called the corona radiata. I'll show you a picture in just a second. Gray matter is going to include the gray matter, which is going to be primarily cell bodies, dendrites, and it can be unmyelinated axons, but it's primarily cell bodies and dendrites. This is going to process information. Excuse me. There are specific collections of gray matter that we've talked about. The cerebral cortex, it's like the orange of the skin around the outside of the brain. Basal nuclei and diencephalon are deep in the brain, okay? They're going to include, the diencephalon is going to include the thalamus, hypothalamus, and epithalamus. There's different structures to the basal nuclei that we aren't going to get into. But those basal nuclei and diencephalon are going to deal with autonomic functions in the body. The diencephalon includes the thalamus, hypothalamus, and epithalamus, also known as pineal gland. Now, the thalamus is actually very complex. I'm simplifying this for you. This is like the little mini man that you see in the brain on Men in Black. I don't know if you've seen that movie. If you haven't, I got to get a video. Maybe I'll try to do a video at some point of it. There's a little guy that lives in this alien's head, and he sits right in the center. And he takes all the incoming information and processes it. That's what the thalamus does. The thalamus brings information in, sensory information specifically, and sends it to the part of the brain in which that sensory information is processed. So vision would come up to the thalamus and then go to the occipital lobe. Speech would come to the thalamus and go to the left side of the parietal lobe. Okay, so the thalamus is going to process all that sensory information coming in. Send it to the area in the brain where it processes it. The hypothalamus does a ton of stuff, It actually has a connection to memory through these olfactory relays, also known as the mammillary bodies. We have a very strong sense of correlation between our memory and smell, and this is where it comes into play through the hypothalamus. There's also what's called an infundibulum, which is going to connect the hypothalamus to what's called the pituitary gland. We're going to talk about this more specifically in endocrine, okay? The infundibulum helps the hypothalamus talk to the pituitary and regulate hormones in the body. As you can see, the hypothalamus also helps to regulate heart rate, digestion, respiration, emotions, body temperature, big one, body temperature, hunger and thirst, okay? Endocrine is going to be glandular secretions that we'll talk about in the future. So the hypothalamus is huge. It really has a lot of control over many parts of the body. The epithalamus is known as the pineal gland. The pineal gland is at the base of the skull in the back. It releases a substance called melatonin, and it helps to regulate sleep-wake cycles. I don't have a movie, I'm sorry. I should have removed that. Melatonin is released at highest levels in the evening, and it will help to facilitate sleep, okay? The levels of it decrease towards the morning, and you actually have a release of adrenaline in the morning that helps you get up first thing in the morning, okay? So this pineal gland is very important in regulating sleep-wake cycles. Melatonin is actually a supplement that you can get over the counter and use it to help regulate sleep-wake cycles. I think it's a good thing to take, especially if you work at night. They're starting to link low levels of melatonin with cancer with people who work at nighttime because they don't have the regular release of melatonin in the evening that they would have if they slept in the evening, okay, because they're staying awake. So, good thing to know. Brainstem, you're going to have midbrain, pons, and medulla oblongata. We're going to look at these in lab. The midbrain is going to include what are called the cerebral peduncles. They actually contain axons, which are going to take motor signals from the brain down to the body. The midbrain also contains the corpora quadrigemina. That's called so because what corpora means is body, quad means four, This is a structure of 4 round structures that help to coordinate vision and auditory reflexes. And that reflex is the startle reflex. If somebody comes in and throws a flash bomb, your body is going to automatically bring that information in, send it to the corpora quadrigemina, and our response is to look at it so we can see if we got to get the heck out of here if something's happening. Okay, so corpora quadrigemina. The pons has several structures in it. It sends fibers through it going from the brain to the body, but in addition to that, it also is the main center for respiration. Medulla oblongata is going to have control over some respiration as well. Cardiovascular centers, what that means is heart rate and blood pressure in the vomiting center. There's actually an area in the medulla oblongata that doesn't have a blood-brain barrier. So the blood can come up and we constantly monitor it for infectious agents, poison, for example. And that vomiting center can kick into play immediately and get rid of those poisons. Cerebellum is going to be at the base of the skull right underneath the occipital lobe, and it's going to coordinate movements of the body. Playing the tuba, driving, playing a sport. The cerebellum helps to coordinate that. It doesn't initiate movement. It helps to coordinate it. There are 2 cerebellar hemispheres connected by what's called a vermis, a little stalk of tissue between it. Now the cerebellum also has a homunculus. You can see this little alien-like guy. You may have to zoom in on this to see him a little bit closer. It's just like the homunculus that we talked about with motor and sensory of the body. You can see that the hands and the feet and the head are a little bit bigger and the body is a little bit smaller. And it's that whole concentration of nerves, okay? So parts of the brain, I'm going to play this silly little video for you. It really reviews a lot of the things that we've already talked about before we move into functional brain systems, okay?
Yo everyone, this is Connie Southeast. I'm about to drop the beats. There ain't gonna be no beat.
Oh, that's right. This doesn't work.
Parts of the brain.
I'll leave it
Ready?
like this.
Here we go.
Okay.
Everyone around the globe has 4 lobes. I'm so wise I name them clockwise. Frontal, parietal, occipital, and temporal. You see, your frontal makes all the decisions. Parietal gets all the rap from your sense of touch and position. Occipital's the all-seeing lobe. And temporal hears everything. Gnarly, yeah. Frontal makes all the decisions. Parietal gets touch and position. Occipital sees you. Temporal hears everything. Ever wondered how you speak? I'll spill that info. Your angular gyrus turns the word into code. The worm decodes and broken commands. And finally, your motor cortex speaks. Now isn't that grand?
Parts of the brain.
Angular gyrus makes code.
Parts of the brain, yeah.
Worm decodes.
Parts of the
Broken
brain.
commands.
Parts of the brain, yeah.
And your motor cortex speaks. Some parts of your brain are old fogies, like the brainstem, medulla, reticular formation, thalamus, and cerebellum. Medulla controls your breathing and heart. Reticular formation arouses you. Thalamus switches all the switches. Cerebellum keeps you balanced. But don't forget the brainstem.
Parts of the brain.
Medulla controls your breathing and heart.
Parts of the brain,
Reticular
yeah.
formation arouses you.
Parts of the brain.
Thalamus switches all the switches.
Parts of the brain, yeah.
Cerebellum keeps you balanced. Brainstem. Limbic System's donut. Drives all your emotions. Amygdala. Hypothalamus. And pituitary gland. They don't just fear and anger. Hippocampus. Pituitary gland. Parts of the brain. Amygdala's fear and anger. Hippocampus helps your memory. Hypothalamus controls emotion. Your cerebral cortex is the maestro of your brain, so intricate, yet so awesome. Corpus callosum connects your two hemispheres, unless you want to split brain. Motor cortex controls all your movements, and your sensory cortex finds all your outer senses. Those are the parts of the brain. Isn't that flippin' awesome? Cerebral cortex is the maestro. Corpus callosum connects your hemisphere. Motor cortex controls your movements. Sensory cortex finds your senses. Nothing but the truth. That is your brain. Like I told you, no pain. My name is Kanye Southeast, signing off.
Okay, a little crazy there, isn't it? They get a little crazy, but it's fun. And to be honest with you, it's just a really, really, really good review. If you're having a problem remembering all these different parts of the brain, it's a great thing to review over and over again to help get some of those parts of the brain in your head. Haha, no pun intended. Okay, so limbic system. There are several parts of the limbic system. You can see they're all labeled here. But what I want you to realize with the limbic system is its emotional responses, and that the sense of smell is directly tied into limbic system. This way we have such strong responses to smell with our memories, okay? Direct connections, pretty cool. You know, so if you walk into the house at Thanksgiving time, you smell that turkey, you smell the apple pie, it takes you right back to last year's Thanksgiving. Okay, it's that quick emotional response. It's so directly tied into the sense of smell. Reticular formation. I have neurons and white matter of brainstem. Somebody pointed this out to me in lecture. This is actually areas of gray matter that are found in the brainstem that help to facilitate consciousness. So if they're damaged, or if we're put under a general anesthetic, they're dampened and we don't have that sense of consciousness anymore. Okay, it's located in different areas of the brainstem. It also helps to filter unnecessary information. So when you get dressed in the morning, you don't go through the rest of the day going, oh, I have my clothes on, 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 I have my glasses on, I put jewelry on. If you had all that information coming in all the time, you would be in sensory overload. The reticular formation helps to filter that unnecessary information and realize what's necessary around us. Painful or uncomfortable stimulation, for example. Okay. Higher mental functions are tested and monitored by EEGs. EEGs are electroencephalograms, which are going to measure the brain waves in hertz. And this is a measurement of the electrical activity, the movement of those charged particles, sodium and potassium, in the brain. Now, different brave-wave patterns are going to be indicative of specific levels of consciousness. So if we look at this next slide here, alpha waves are going to be relaxed as if you are in a meditative state. They're 8 to 13 hertz, okay? They're regular and rhythmic, low amplitude, pretty replicable, okay? Beta waves are rhythmic. They're less regular though. They're when we're alert and awake and mentally active, 14 to 30 hertz. And you'll see they're not quite as rhythmic as the ones, it says it's rhythmic, but it's not as rhythmic as the alpha. Theta wave are more irregular, common in children, uncommon in adults, but can be seen in deep, deep, deep meditation of people who have practiced that for long periods of time. Delta waves are 4 hertz or less. They're high amplitude waves seen in deeper sleep, okay? So we're going to try, or during anesthesia, we're going to try to do these electroencephalograms in lab. Now, obviously the brain waves should match the activity, okay? If somebody is awake and alert, they should be showing beta waves. They shouldn't be showing delta waves, okay? You would use these to check if there's brain damage, or in the case of seizures, you can use these EEGs. There's alpha waves up top, Okay, awake but relaxed. Beta waves, you can see, are just more active. That makes sense. You're awake, alert. You're probably going through a series of different activities and your brain is working. Theta waves are common in children. You can see them in deep meditative states with adults. Okay, not as active as beta, a little bit more spaced out. But delta waves are going to be in deep sleep, and you can really see that they're long and flowing, and they look like they're somebody who's not as quite mentally active. Okay. Epilepsy is a torrent of electrical charges that happens in people's brain that can vary in intensity, all the way from you wouldn't even know that somebody has seizures to it's very obvious they go into what's called tonic-clonic. Okay. Now, absent seizures or petit mals are so minimal, the person might be talking to you, pause during their seizure, and then move on. Okay, they're really minimal. They don't really interfere with the person's activities. People barely even notice that they have it. Grand mal is massive. This is tonic-clonic, which means that they'll move into an arched position, they'll move their hands down, they'll arch their back, and then they relax, and then they arch their back, and then they relax, and they arch their back, and then they'll relax. They may lose their bowel and bladder. They may bite their tongue. They can't swallow their tongue. People used to say that you're supposed to put something in their mouth. Don't ever put something in their mouth, okay? You want to support their head, but they can't unfortunately bite their tongue. An aura can occur before, and that gives them a trigger to let them know that it's going to happen. An aura can happen with migraines as well. What that means is that they'll have a weird sense of smell or vision before it happens. Quite often, people who have epilepsy or migraines will have an aura of smelling oranges, smoke, or burnt toast before they have a seizure or a migraine. Or they can get a change in their vision, like tunnel vision. That is a precursor that alerts that person that there's probably going to be a problem. And if they're epileptic, they know enough to lay down so they don't fall down and hit their head. The other kind of cool thing that they're doing with epilepsy is they're training dogs. So the dogs know that that person's going to have a seizure. And the dog will give them a signal. Quite often it's the dog laying down, that that person should lay down so they don't hurt themselves. Control by anticonvulsive drugs, and also there's something called a vagus nerve stimulator. It can be implanted into the skin, and it stimulates the vagus nerve, which actually calms the nervous system, and it'll calm the brain activity. Pretty cool. Fainting or syncope is going to be a decrease in blood pressure that can eventually lead to coma, or can just lead to people, well, it can eventually lead to coma. Let me back that up, sorry. The decrease in blood pressure can lead to people getting a little bit lightheaded, can lead people to getting, blackness in their vision, to passing out. If that continues, it can lead to coma. There's varying degrees of this, okay? Coma, of course, would be when someone's unconscious and they have low levels of oxygen use. So there's a whole spectrum of this that you'll learn if you go into nursing, okay, about the awareness or consciousness, okay? Consciousness is our perception, voluntary initiation of movement, capabilities of being able to remember, or logic with people. Loss of consciousness, fainting or syncope, is a signal that brain function is impaired. Okay, so you can go through these different stages: alertness to drowsiness to stupor to coma. Okay, there's all sorts of definitions. I just want you to be aware of those general terms for now. Brain activity. Moving into sleep. Sleep is a state of partial unconsciousness that you can be aroused from. Two major types. There's non-rapid eye movement, NREM, or REM. I think probably most people are familiar with that. Rapid eye movement. Now, moving into that rapid eye movement is the point in our sleep, and there's actually different stages of non-rapid eye movement that we'll move through until we'll get to rapid eye movement. Then we cycle through again. You usually cycle through all these stages about every 90 minutes, okay? The difference between non-rapid eye movement and rapid eye movement is during rapid eye movement, the eyes will move and we do dream. And you can dream in some of the phases of non-rapid eye movement as well. But most of the dream activity will happen during rapid eye movement. And this is when our brain will actually paralyze our body. I mean, it's not paralysis like you're thinking. It just decreases movement. Because during rapid eye movement, when you're dreaming that you're moving. Okay, so your body's got to dampen that movement. Okay, so first two stages of non-rapid eye movement occur during the first 30 to 45 minutes of sleep. Fourth stage is achieved about 90 minutes, and then REM. Okay, then you move into REM. So 4 stages of non-rapid eye movement, then into REM sleep. You cycle through all of them approximately every 90 minutes. Oh, did I skip a page? Okay, so we're not really sure why we sleep, but we do know that during sleep, we restore our bodies, a lot of healing happens, and it's also very important for memory and learning. Very important. That's why it's important not to pull all-nighters. If you pull an all-nighter, you don't have time to transfer all that information that you memorize from short-term to long-term. Now, serotonin is released to stimulate our need to sleep. Serotonin is going to calm us down. This is actually made from the tryptophan from turkey that makes us sleepy. We also need that melatonin, okay? Norepinephrine is released to wake us up. This is our noradrenaline, just like the adrenaline that people get when they're shocked, okay? And then that reticular activating system will be dampened, and then activates us to sleep as well. So that contributes to sleep as well. Here's the different stages, okay? REM, okay? Most dreaming, you could see that at the top there. So we're awake, then we move into REM. Skeletal muscles, except the ocular, which is the eye muscles and the diaphragm, are actively inhibited. Most dreaming occurs. Our muscles are inhibited, so we don't sleepwalk, so we don't move. Not that that can't happen, but it helps it, okay? Non-REM, you can see you can walk yourself through those, okay? 1 through 4. And 4 is where we get those delta waves that we just talked about, okay? I thought this was kind of interesting. Looking at infants versus adults, we need a lot less sleep as we get older. Look at all the sleep that infants and children need. They need a fair amount, okay? And then it decreases as we get older. Sleep disorders. Narcolepsy is lapsing abruptly into sleep from the awake state. This is a really strange thing. And quite often it'll actually be stimulated by excitement. So the person will be talking to you, ha, boom, they fall asleep. Okay, so it's something that people are born with and live with their whole lives. There's really no treatment for it, okay? Insomnia, we know what that is the chronic ability to not sleep. And some people just are insomniacs. Not me. Love my sleep. Sleep apnea is going to be the cessation of breathing during sleep. That's a really strange thing if you know anybody with sleep apnea, because they'll be breathing, then all of a sudden they'll hold their breath, and then the centers that regulate breathing kick in, and they take this really deep breath, gasping breath, and then they start breathing again, then they stop breathing, then they go through the whole thing again. And it's just a little glitch in the brain that doesn't regulate, in the midbrain, I should say, the brainstem, I should say. It doesn't regulate their breathing appropriately. And when enough carbon dioxide gets built up, their body says, ooh, we got to get rid of this carbon dioxide, and starts breathing again. Okay, so varying degrees of that, from very minimal to people need, those masks to help them breathe better at night. Memories. So we've got short and long-term memory. So short-term memory is going to be basically located in part of the limbic system. The limbic system will process the short-term information, and then overnight when we sleep, we'll transfer it to long-term memory if it's important for us to remember. Okay? Now, what makes it important for us to remember? There's a couple of things that contribute to this. Oh, I don't think I have this in here. Okay, so the transitional curve, something is important enough for you to remember. If you, if you meet somebody, you think they're really cute, you get their phone number, you're going to remember that phone number. You're going to memorize it. You're going to transfer it from short-term to long-term. Information that you study repeatedly will be transferred from short-term to long-term. In addition, information that is traumatic for us will be transferred, unfortunately, from short-term to long-term. So there are a couple of different things. So repetition is one thing that helps us transfer that information. The importance of that information helps that transference, and also if something was traumatic, it'll be transferred from short-term to long-term. Okay. So, and once again, during sleep, we're going to transfer information from the limbic system to the prefrontal cortex, which is our long-term memory. Okay, so it's important to get good sleep before you take your exams. Different sorts of trauma, these are generalized trauma I want to talk to you about. It can happen to the brain or the spinal cord. We're still talking about central nervous system. We can get cerebral edema, which is going to be swelling with the brain. This could be either traumatic or it could be infectious if we get an infection in the central nervous system. Now, a concussion is also called a contusion because it's basically a bruise to the brain. We can also bruise the spinal cord. We can have a blow to the head or the neck. Unconsciousness can occur if there's enough pressure around the brainstem. It'll affect that reticular formation. We can lose consciousness. We can get blurred vision, confusion, nausea, vomiting. It all depends on which areas of the brain are affected. Okay. Where do we inject for epidurals? We're going to talk about more of this when we get into bones. Epidurals, it's when we talk about bones, I'll show you exactly where on the skeleton we do epidurals. But for our purposes here, epidurals will be done on top of the dura mater. Okay, so epi means on top of. It'll be on top of the dura mater, and then it'll go down and bathe the top of the dura. Now, subarachnoid versus subdural bleed. If you think about the three layers of meninges, we've got dura, arachnoid, and pia. So the subdural space is going to be below the dura mater, but above the arachnoid. If that doesn't make sense, just draw a quick picture of those three layers. Boom, boom, boom. Okay. So the subdural space is going to be underneath the dura mater. The subarachnoid space will be underneath the arachnoid mater, and that'll be between the arachnoid and the pia. Now, it's important to know the difference because if there is a hemorrhage in the brain between the meninges, a subdural bleed is not nearly as dangerous as a subarachnoid. We learned in the subarachnoid space we have cerebral spinal fluid and a lot of blood vessels. If we get a bleed into that area, we're going to get blood into the cerebral spinal fluid, increasing chances of infection. And we also have a lot of blood vessels that are arteries. So if we get damage to one of those arteries, there's going to be higher pressure that can let more blood into that subarachnoid space. Okay. So subarachnoid is worse than subdural. It's an important thing to know. Okay. Now, any sort of hemorrhage can push down on the brain and force it through the foramen magnum, which would affect the brainstem. Not good stuff. Brainstem is going to control respiration, heart rate, blood pressure, respiration, if I didn't already say that. So if we put pressure on that, it can actually stop functioning. That's why people with concussions need to be observed to make sure that their breathing doesn't stop. Okay. Cerebral vascular accident is going to be when a clot or fat blocks an artery. Cerebral vascular accident is what that stands for. The area beyond the blockage in that blood vessel will not be getting blood supply. Okay, the area beyond that will not get blood supply, which can lead to what's called ischemia, or death of that tissue beyond that clot. Now, this can be something called a transient ischemic attack. So TIA stands for transient ischemic attack. Transient ischemic attack means that a clot is thrown, it lodges in a blood vessel, it stops the blood flow. Now blood flow isn't getting beyond that clot, and then it dislodges and it goes somewhere else. So it's transient ischemic tissue damage and then attack. That'll usually remit within 24 hours, okay? But the problem is somebody with a TIA probably has more clots that'll cause another blockage at some point, okay? Now that's the most benign form. If we move into the more aggressive forms, we can actually get blockage that permanently blocks that blood vessel unless there's surgery or medication administered, okay? And that would be a cerebral vascular accident. Okay, so transient ischemic attack is going to be more benign. Cerebral vascular accident is going to be way more aggressive. It's going to be a blockage until there's some sort of medical intervention. Okay. And this is where we get strokes, cerebral vascular accident. The brain tissue beyond that can die. Now, if somebody throws a clot in the brain, one of the first things that they'll administer is tissue plasminogen activator, or TPA. We'll talk more about this when we talk about blood, but plasmin actually breaks clots down. Plasmin breaks clots down. Medical people call it TPA. If this is administered within 7 hours or less, there's a chance they can break up that clot and that patient will have prolonged damage from it. Pretty cool. Pretty cool that they can do that. Different types of infections. So meningitis that we have spoke about, that's going to be infection of the meninges that can stimulate or simulate a flu. We can also get encephalitis, which would be an inflammation or infection of the brain that's usually viral. Can be from herpes simplex, can be from mosquito bites or HIV, okay? Or from meningitis. You could get a headache, you'll have fever and fatigue, and obviously confusion. Can move on to seizures, okay? So kind of bad stuff, kind of bad stuff. This is where that West Nile is a problem. You get that West Nile virus from mosquito bites, and it causes encephalitis and meningitis. Bad, bad stuff. Multiple sclerosis is an autoimmune disorder in which the myelin sclerosis or hardens. So the myelin, or those fatty sheets around axons, don't work appropriately anymore, and that patient won't have appropriate action signals, or action potentials, I should say, anymore going through the nerves. Can cause all sorts of problems depending on where the myelin is damaged. Obviously, muscle weakness, visual impairment's one of the first things that always happens. The patient will say, you know, I just don't see as well as I used to, or I focus and it goes out of focus. Or I'll grab my mug of coffee in the morning and I drop it. These kind of insidious, very slow progressing problems that eventually can lead all the way to very spastic paralysis. They're doing amazing things with MS. I believe we talked about one of the previous lectures with medications that's really stopping the progression of the symptoms. It's pretty amazing. ALS is going to be another central nervous system disease. It's called Lou Gehrig's disease, who was a baseball player. It's not hugely predominant. It's approximately 30,000 people in the US. And what happens is that there is damage from an autoimmune component, which means that our body is attacking its own tissues. It causes paralysis of the front of the cord. So front of the cord, once again, is going to be motor. And if it affects that motor, that person can start to get paralysis or lack of movement. But the real problem is when it damages the motor to the diaphragm and the intercostal muscles. Now, the diaphragm is your primary muscle of respiration, and the intercostal muscles help with respiration as well. So if they have paralysis of the diaphragm, it's going to lead to death, unfortunately, unless they're put on a ventilator. Okay? Sad, 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 sad disease. Parkinson's is going to be when there's a decrease in release of dopamine from what's called the substantia nigra in the brainstem. Now, it causes stiff joints and muscle tremors. That patient actually has what's called a mask facies, where they don't have very good expression. They have a stooped posture, and they tend to walk flat-footed, and they tend to rub their fingers together. And it's called pill rolling. And it's a movement that'll happen when they're at rest, but then when they go to move, they stop doing it. Okay, so when they're moving, that pill rolling, and the pill rolling, I should bring it back out. I know probably it's just a little thing, but they'll sit there and they'll do this. It's called pill rolling because it looks like they're rolling a pill between their fingers. And they'll do that when they're at rest, and then when they move, they're able to stop doing that. Okay, when they engage those muscles, and when they stop, they go back to it again. They'll have a mask-like faces. They won't move their face very much. My Parkinson's imitation, I'm sorry. And they won't talk, and they're very expressionless. And they have this forward, stooped posture. And when they walk very flat-footed because they can't really coordinate their movements well, okay? This is something that just happens, that the body attacks those dopamine releasing cells in what's called the substantia nigra. And dopamine is a neurotransmitter which is going to help to coordinate movements for people. So if you don't have enough dopamine, you're not going to be able to coordinate those movements, and you get all of these weird physical, they're not weird, these physical presentations, okay? So what they try to do is they're trying to do stem cell implants, which come from fetus in that substantia nigra, to help take over that dopamine releasing role. It's kind of controversial because we don't like using those stem cells from fetuses, but we're harvesting stem cells from other areas in healthy people. The nasal cavities, believe it or not, is one place that they're harvesting stem cells. Bone marrow is another place. So they're making progress with that. Okay. Alzheimer's is basically dementia, and it happens because there is destruction of the nerve fibers in the brain. And the destruction of these nerve fibers, it's called neurofibril tangles. I'm going to zoom you back in. Neurofibril tangles, okay? So the fibers, the axons and the dendrites that come off the nerve cells actually get a deposition of protein, and they get tangled up. And people cannot function as they used to. And it starts to show as mental impairment, loss of short-term memory, and dementia. Pardon me. They also have emotional issues because it affects that limbic system and the frontal lobe, okay, are the two areas that it's going to affect. So frontal lobe will affect their personality, their memory. Pardon me. Limbic system affects their emotional personality. Acetylcholine is going to be a neurotransmitter that will be decreased in people with Alzheimer's that it shouldn't be, okay? And a PET scan is going to show, PET scans are used to show the uptake of glucose and the uptake of oxygen as well, I believe. I would have to double check that. So a PET scan is going to basically show physiological activity in a brain. And this is a good one. This is how Alzheimer's, or one of the ways that Alzheimer's is diagnosed. And you could see that patient's brain on the right is going to have decreased activity from the one on the left. Okay, that would be positive for Alzheimer's. Brain tumors can cause abnormal growth. They could be cancerous or not cancerous, but both are a problem because nerves do not like pressure. They don't like pressure, not at all. So even if it's a benign tumor that's encapsulated and not going anywhere, if it keeps going, the pressure of that tumor can cause all sorts of problems depending on where it is. Okay, if it's near the olfactory nerve, it's going to affect the sense of smell. If it's near the optic nerves, it's going to affect your sense of vision. Okay, so anything that grows in the brain is a problem. Cancerous obviously is going to be a problem. It'll metastasize and spread out to other areas and can affect those areas. Poliomyelitis, we don't see this as prevalently as we used to. This is going to be an infection from feces and water. Sorry to tell you this, but when we weren't as good with our septic systems and the cleaning of our water, feces used to infect water. Polio was spread through this fecal oral way. Okay? Starts as flu-like symptoms and it causes paralysis later because it affects, once again, the front component of the cord, affecting the motor of the cord. Pardon me. Spina bifida. So there's different types of spina bifida. Okay. So if we, and let me see what else. Okay. I wasn't sure if I had more notes about this or not. So spina bifida, I'm going to bring you back out. Spina bifida is something that occurs in infants when they develop. So a huge vitamin that helps to prevent it is folic acid. So if you or someone you know is going to get pregnant, they want to start taking at least folic acid, if not a complete multivitamin. Pardon me. Spina bifida can occur if they don't take folic acid. Now, what spina bifida is, if you can imagine, I'm going to take one of the vertebrae from your spine and I'm going to turn it up on end. And what should happen is we've got the body in the front, okay? This is the front of the vertebra. And then we've got this bony canal in which sits the spinal cord. That's how we encase the spinal cord with the vertebra of the spine. This would be a normal presentation. This was how one of my vertebrae would look. If I were to take it out, this would be anterior, this would be posterior, okay? People with spina bifida, what happens is that posterior part of the spinal canal God, I'm so sorry, I'm such a bad drawer. Doesn't close. So people with spina bifida, it doesn't close. And what can happen is it can stay a little bit open and the meninges in the spinal cord are still in this nice opening in the center and it's not a problem. And a lot of times this won't even be found until they strain their low back and they get an x-ray and they're like, wow, you have spina bifida, okay? That is known as spina bifida occulta because it's hidden almost like a cult. Nobody knows about it until some incidental finding makes them take an x-ray, okay? With spina bifida occulta though, they can have a little patch of hair over that area. For some reason it stimulates growth of hair over that area, okay? Spina bifida occulta. Spina bifida cystica is way more progressed from this. And what happens is the spinal cord can stay here, but the meninges can start to bulge out, okay? Or the meninges and the spinal cord can come out, okay? So cystica almost forms like a cyst with either just the meninges or the meninges and the spinal cord coming out. So spina bifida cystica, okay? So take folate, it's an important thing, okay? And that, I'm sorry, just to back up, spina bifida cystica needs surgical intervention. That's why it's important to get all the blood tests done while you're pregnant, because the blood tests actually can come up positive for spina bifida, and if it is, you need to have an ultrasound to see how progressed it is. If it's really progressed, there has to be a neonatal surgeon on staff ready when your baby's ready to be born, or sometimes they have to do surgery in utero. So it's nothing to fool with. It could be permanent damage for your baby. Okay, so spinal cord, we've got the spinal nerves, there are 31 pairs, and then we have in the spinal cord, I'm actually going to pause the tape and restart it on spinal cord, okay? So that way we can just break up the tapes a little bit. I'm gonna get a quick cup of coffee, I'll be right back.